This video you will learn all about probiotics. What are probiotics, why you need them, why they do not always work, who can take them, how to use them, and we finish with what to do during and after antibiotics. Probiotics are living bacteria that can have a positive effect on your gut microbiome. Probiotics act as a cleaning crew in your large intestine, improving the intestinal environment. They do that by making the intestinal content more acidic. By producing these acids, our own bacteria can multiply and function better. It improves bowel movement or peristalsis and makes you less vulnerable to pathogens. So where do we find these living bacteria or probiotics? You can get probiotics from foods or supplements. Probiotics occur naturally in fermented foods, such as sauerkraut, kimchi, kombucha, kefir, raw apple cider vinegar, miso, tempeh, natto, yogurt, and pickled vegetables. Try and gradually introduce these foods in your diet. Your gut will be very happy. Probiotics can also be found in supplements and yogurt drinks like Yakult or Activia, but these contain a lot of sugar, so natural alternatives like fermented foods are better. So why should we take probiotics? We always need contact with living bacteria to keep a healthy microbiome. Before the fridge was invented, fermenting was a great way to preserve food. But nowadays, contact with good living bacteria is often minimal. Pickles are no longer fermented, but are preserved with vinegar and sugar. Yogurt is often pasteurized, heated, killing all harmful, but also the good bacteria. Our bacteria need to have an optimal environment to live in, which is often not the case. So a daily dose of probiotic foods or supplements is no unnecessary luxury. Then again, should you take it the rest of your life? If you do not have digestive issues and feed your bacteria enough prebiotic fiber, no, you don't. In case you do have digestive issues or have an inflammatory disease like ulcerative colitis or Crohn's, it is especially important to keep your gut microbiome in the best possible shape, and lifelong probiotics can greatly improve symptoms. So now we know where to find probiotics and why to take it, being especially important for people with digestive issues. But probiotics do not work for everyone. Why is that? Probiotics are not magic. If you suffer from an underlying cause like allergies, intolerances, or a shortage of gastric acid, probiotics are not going to do the trick, because you're not addressing the root cause of the problem. That is why we are working from mouth to butt, eliminating as many possible causes by using the RICH method, looking at our stress tolerance, and checking the acidity of our stomach. So we just established that probiotics is not magic, but that does not mean that it cannot make a major difference for people. But who can take probiotics in the first place? In general, probiotics are safe to use if you have immunosuppression, serious health conditions, heart valve implants, or heavy medication. It is important to consult with a doctor first. Taking probiotics in combination with some medication can even be beneficial. Certain antidepressants and non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen, can affect the composition of your microbiome in a negative way. So, if you have to take long-term medication, it can actually be very beneficial to use probiotics next to it, to keep your gut bacteria happy. Just talk to your doctor first if it is safe in combination with your particular medication. So now we know who can use probiotics, but how to use it. Probiotics don't work like other vitamins, taking vitamin D for 2 weeks and then the shortage you had is gone. Probiotics have to be taken at least 2 to 3 months in order to really make a difference. When starting with probiotics as supplement and you have a sensitive digestive system, start with a quarter dose for the first few days and slowly increase it to a normal dose. You may feel some slight discomfort. That is normal. There's work going on down there. Though, it should never hurt or give major discomfort. If it does, stop with the probiotics until you feel normal again, and then you might want to try again to make sure it was not a stomach flu or something. If the same symptoms reoccur, then this was just not the probiotic for you. It is really a matter of trying. Everyone has a different composition of bacteria, and what works amazing for you does not have to work for your neighbor, and vice versa. Unfortunately, there's no way of knowing what works for you. Just trying it is the best way. There are a few things you need to look at when choosing probiotics. I have added a PDF this week on how to choose the right probiotics. In some cases, you may need antibiotics. Do you remember the last time you had it? Antibiotics kill the bacteria in your gut, the good and the bad ones. Did you know that after one treatment of antibiotics, it takes about 3 months for the gut microbiome to recover? After 2 treatments within the same year, it takes about 12 months. Luckily, we can support our microbiome with probiotics. Probiotics do not counteract the effect of antibiotics. Antibiotics kill all bacteria and pathogens, and the probiotics replenish the good bacteria. In different countries, including Germany, doctors prescribe high-quality probiotics with an antibiotic treatment because they recognize how important it is to support your gut microbiome when completing a course of antibiotics. Take a high-quality probiotics. Use probiotics during your course of antibiotics and continue a minimum of 3 months after you finish with your antibiotics. Alternate between different types of probiotics. Use a different type every month. Also remember to feed your bacteria. Eat enough foods that contain prebiotic fiber. In the PDF on antibiotics, you will also find a detailed schedule on the exact times to take the probiotics. Your microbiome is not the only one having a hard time during an antibiotic treatment. The liver and kidneys also have to work extra hard to process additional waste products. You can support your liver and kidneys yourself. Liver loves bitter. Bitter vegetables such as chicory, rocket, Brussels sprouts, artichokes and endive. Kidneys love making you pee. You can support them with diuretic foods such as fennel, celery, asparagus, dandelion and nettle. In addition, organ meat, liver, supports your liver, and kidneys support your kidneys. Preferably choose organic and, where possible, grass-fed organ meat. To conclude, you now know what probiotics are, where to find them, why they do not always work, who can take probiotics, how to use them, and what to do during and after antibiotics. Having learned about your microbiome, prebiotics, and probiotics, you now have the tools to support your gut health.